Okay, so on to the humerus. First, to introduce the upper limb includes the humerus, the radius and ulna bones, the carpal bones of the wrist, and the metacarpals and phalanges of the hand. So the humerus is the bone in the upper arm. It's the only bone in the upper arm. It has a round head that articulates with the scapula at the glenoid cavity. And that's one of the reasons that we can move the glenohumeral joint in so many directions, is because we have a shallow cup with a round head, allowing for a great range of motion. Okay, so now some bone markings past the round head. So there is the greater tubercle on the lateral surface of the proximal epiphysis of the humerus. It's the insertion site for three muscles that originate on the scapula. The three muscles are the supraspinatus, the infraspinatus, and the teres minor. We'll learn them during muscles. And there it is for now. There's anterior and posterior views. The lesser tubercle is on the anterior medial surface of the epiphysis of the humerus. It's the insertion site for the subscapularis muscle that originates on the scapula. The intertubercular sulcus, or groove, separates the greater and lesser tubercles. The tendon of the long head of the bicep brachii is found in this sulcus. And remember, this long head of the bicep brachii was attached to the supraglenoid tubercle, and now it has to get to the bicep brachii muscle, and the tendon fits into this intertubercular sulcus. Okay, the anatomical neck of the humerus is a constriction between the head of the humerus and the greater and the lesser tubercles. You can see in the picture where the arrow is pointing, it doesn't look like much of a neck. It's not much of a constriction, and it's pointed to in the left picture there. The surgical neck, distal to the tubercles, is where the metaphysis is found, and it is so named because fractures typically occur at the surgical neck. It really doesn't look like much of a neck, in as a neck you would think of maybe something skinny underneath the head, and it's really not that skinny. But you can look in the picture on the right lower side, and you'll see that Martini's drew a little ring around it, and you can see where the surgical neck is, and you can compare where the anatomical neck and the surgical neck are on the humerus. So now moving inferiorly, the deltoid tuberosity is on the lateral shaft of the humerus. And the deltoid tuberosity is the insertion site for the deltoid muscle that originates on the clavicle and scapula. Okay, so we have our deltoid muscle up here, originating on the clavicle and scapula, and then flowing downwards over the cap of the shoulder and inserting on the deltoid tuberosity, which is this sort of gentle swelling on the lateral humerus. And you can feel this in your own arm. It's a nice little swell there on the bone. Okay, so now let's drop down to the inferior most point of the humerus, the distal epiphysis, and get to some interesting bone markings down there. There is a joint surface called the trochlea, okay? And really look at what's being called the trochlea down at the bottom of this picture to the right. The trochlea has sort of two bumps, and trochlea means pulley. So this looked like a pulley to the anatomist, right? So it's these two bumps that are more medial on the distal epiphysis, right? And they're called the trochlea. And the trochlea articulates with the ulna bone. We haven't talked about the ulna yet, but just remember the trochlea articulates with the ulna. The coronoid fossa articulates with the coronoid process of the ulna. So if you look again at the bottom of this picture here, and you look at this dent called the coronoid fossa here above the trochlea, just superior to the trochlea here, there's a part of the ulna that fits right into that dent, okay? The part is called the coronoid process, and the little dent where it fits is called the coronoid fossa. More about that when we talk about the ulna. Then lateral to the trochlea is a joint surface called the capitulum. And the capitulum articulates with the head of the radius, the other forearm bone. If you look on the lower right picture here, you'll see that we're looking inferiorly, and they're showing you where the trochlea is and where the capitulum is. Now, sticking out from either side of where the joint surface of the trochlea and the capitulum are epicondyles. There's a medial epicondyle and a lateral epicondyle. And epi means beyond, and condyle means a joint surface. So the word epicondyle means that these bone markings are beyond the joint surfaces, right? They're not actually part of the joint itself, okay? And they're easy to feel. You can feel them in your own elbow area. They're the bottom of the humerus, and I could help you in class if you don't know if you're feeling your medial and your lateral epicondyle. Okay, and they're attachment sites for muscles, just like a lot of these other bone markings I'm teaching you. Okay, the posterior humerus has a deep olecranon fossa where the olecranon of the ulna articulates. So we just anteriorly learned that there's a coronoid fossa, what I called like a little dent, where the coronoid process of the ulna fits. And now we're learning that there's an olecranon fossa where the olecranon of the ulna fits. And I'll show you more when I show you the ulna bone, but it's kind of cool the way that we fit together. All right. Now, something that we can all appreciate, the area called the funny bone is on the medial elbow region. Okay, so the ulnar nerve crosses the posterior surface of the medial epicondyle, and bumping the medial posterior side of the humerus strikes the ulnar nerve. And then you get that horrible feeling that's a mixture of numbness and paralysis of the muscles on the anterior surface of the forearm, maybe tingling, and a sort of sickening kind of deep pain all at once. And you run around going, I just hit my funny bone. Okay, so moving inferiorly to the radius and the ulna. Let's do the ulna. But just to orient you, the lateral radius bone is proximal to the thumb. All right, if you can just remember one thing, the radius bone is proximal to the thumb. And then you know that the ulna bone is proximal to the pinky. Okay, you don't have to actually remember two things. So, okay, there's the radius, there's the ulna. The anterior pictures and posterior pictures. There is a fibrous connective tissue sheet called the interosseous membrane that connects the ulna and the radius. Between osseous bones membrane. So between bone membrane. There's also an interosseous membrane in the leg, which you'll learn when we get to legs. And this interosseous membrane is an attachment site for muscle. So now let's move on to the ulna and learning about the ulna. So the proximal epiphysis of the ulna has what I think of as a little hand like this, formed by the olecranon, which is the superior most part over here, the trochlear notch, and the coronoid process. The olecranon is the point of the elbow. So if you're, resting your head on your elbows and you're resting on the bone in your elbow, it's your olecranon. And here you can see the olecranon, the trochlear notch, the coronoid process. All right, the trochlear notch cups the trochlea of the humerus. The olecranon fits into the olecranon fossa of the humerus when the elbow joint is extended. The coronoid process fits into the coronoid fossa of the humerus when the elbow joint is flexed. And a good picture to see what I mean is the picture in the right upper corner here, where I'm showing the olecranon fossa with the olecranon process fitting together nicely when the arm is extended, and then the coronoid fossa and the coronoid process of the humerus and the ulna fitting together nicely when the elbow joint is flexed. All right, so it all fits together. And in class, when you have your bone boxes, you can take the humerus and the ulna and make them, fit together, and you can extend and flex them and have fun with that. See how they fit together nicely. Okay, in addition to articulating with the humerus, the proximal and distal epiphyses of the ulna articulate with the radius. So here's the ulna. This is slide 47. I'm just showing you a picture where we can see the whole ulna and radius next to each other. So here's the ulna, here's the radius, medial and lateral. And there's a proximal radio-ulnar joint, and there's a distal radio-ulnar joint where the two bones articulate with each other, right? Proximally and distally. So back down to slide 51. Now, the ulna, you might think, I bet it articulates with the wrist bones at the wrist. Actually, no, it does not. It is separated from the wrist bones by a fibrocartilage articular disc, and it does not actually get to articulate with the wrist bones. Summing it up, the ulna does articulate with the humerus and the radius, but it does not articulate with the wrist bones. All right, moving on to the radius. So the proximal epiphysis of the radius has a circular head. The anterior radial tuberosity is found just distal to the head of the radius, and this is the attachment site of the bicep brachii muscle. And then the distal end of the radius does articulate with the carpal bones of the wrist. So that's kind of an overview of the radius. Now let's get into more detail. So the lateral capitulum of the humerus articulates with the head of the radius. And here we see the capitulum that we learned on the humerus and the head of the radius. And the head of the radius has sort of a very shallow little cup on the top where the capitulum fits. The head of the radius can rotate medially and laterally at the proximal radio-ulnar joint. So now we're talking about the joint between the radius and the ulna. And this round head of the radius can rotate medially or towards the midline or laterally or away from the midline at the proximal radio-ulnar joint. When the head of the radius rotates medially, the distal radius crosses over the ulna, and this medially rotates the hand. Medial rotation of the hand also flips the hand over in a motion called pronation. So take a moment and look here at supination versus pronation. Supination is our starting point because we always think of stuff coming from the anatomical position that we learned in our first lecture. So the reason they chose the position of the hand to be so clear an anatomical position is because it tells you something about the position of the radius and the ulna in relation to each other, okay? So when you're standing in anatomical position, that position is called a position of supination, and that means that the bones are uncrossed. When you're standing with your palms facing backwards, that is a position of pronation, and the radius and the ulna are crossed. Okay, so if you had pronated your hand and then the head of the radius rotated laterally, the distal radius would uncross and the radius and the ulna would be parallel to each other. You can try to remember which position is which by remembering that in supination, you can hold a bowl of soup in your hand. That's helpful. Now, clinical correlation. When a person falls on their hands, okay, the radius can break. It's a common fracture type in the body, a distal radius fracture. And there are multiple different kinds. You can look at this picture to the right here. And the radius is actually one of the most commonly broken bones in the body. I had to put this picture because these are called fouche fractures, fall on outstretched hand fractures. And here's this poor fellow, he's fouching. Okay, moving down to the wrist and the hand bones. So the wrists and the hand have three sets of bones. The carpals or wrist bones, the metacarpals are hand/palm bones. I like to think of them as palm bones so that I really can think of where they are. You know, they're in here, okay? Down here are the carpals. Here are the palm. Then, of course, there's our phalanges, all right? The phalanges being the finger bones. And here I have black, red, and black again, showing you carpals, metacarpals, and phalanges. So you'll understand the groups of the bones and where they are. So first, the carpals or wrist bones, there are 8 of them. These are short bones. They are in the area of the heel of the hand, okay? The heel of the hand. The bones are in 2 rows, a proximal row and a distal row. Ligaments interconnect them. And we are not going to learn the individual names for these 8 bones. Yay. The joints between the carpal bones permit limited sliding and twisting movements. The proximal row of carpals articulate with the distal radius at the wrist, we would call it, right? If you consider this the wrist, okay, I consider it the wrist. Oh, here, right here, right? If you're wearing a wristband, it's here, right? Um, and then the distal row of carpals articulates with the metacarpals. And this picture shows it really nicely. Here's our proximal row of carpals articulating with the radius. It actually makes it look like it articulates with the ulna, but don't be fooled. There would be a fibrocartilage articular disc in there preventing an articulation there. And then in orange, they have the distal row of carpals articulating with the metacarpals. So the metacarpals are found in the palm of the hand here and in the back of the hand here. Meta means beyond, so they're beyond the carpals. The metacarpals are long bones. The metacarpals are numbered from 1 to 5 in Roman numerals. 1 is proximal to the thumb, and that's numbered 1, and so on as we go across to the pinky, which the metacarpal proximal to the pinky is called metacarpal 5. Okay, and the distal epiphyses of the metacarpals articulate with the proximal phalanges or finger bones. Now, once we get to the finger bones, we'll learn that each digit has 2 to 3 phalanges, but we're talking here about the most proximal row of phalanges, and that is, of course, what the distal epiphyses of the metacarpals are articulating with. And this is the joint that we call the knuckles, all right? So the knuckles, your knuckles are the joint between the distal epiphyses of the metacarpals and the proximal epiphyses of the most proximal row of phalange bones. There are 3 groups of phalanges, and phalanges are finger bones, right? So there are proximal phalanges, there are 5. Then there are middle phalanges, there are only 4 because the thumb doesn't have one. And distal phalanges, there are 5 again. The phalanges are long bone. Now, if you're going to talk about a finger, not a finger bone, but a finger, then fingers are called digits, and they're composed of 2 to 3 phalanges, and they're numbered 1 to 5, with 1 being the thumb, and then going across to the pinky, which is digit number 5. And these are not in Roman numerals. These are just in normal numbers that we're used to, 1 through 5. Okay. So that was the pectoral girdle and the upper limbs with the arm, the forearm, the wrist, the hand, the fingers, the clavicle and scapula, being the pectoral girdle, then the humerus of the arm, the radius and the ulna of the forearm, then in the wrist, the carpal bones, in the hand, the metacarpal bones, and the phalanges in the fingers.